terms of getting a diagnosis, you were kind of just made to feel, okay, this is just what you've been dealt, right?
Yeah.
When did you get a diagnosis?
It took 22 years.
22 years.
So I was 34 when I received a diagnosis.
If you have a problem with your health and you go and seek medical help, you don't expect to be ignored, dismissed, or even belittled, but that is the reality often for people who have endometriosis. It's a condition that affects around 1 in 10 women. However, according to recent research, it takes on average around 8 years from actually seeing a doctor to getting a diagnosis. This episode of The Lifestyle Prescription is all about endometriosis, understanding it, and also finding the right support if you have it. I'm Rena Annabelle, and my guest in the studio today is Jen Moore. She is an educator, a speaker, and a campaigner specialising in endometriosis and adenomyosis, and she's also the author of this brand new book. Hi, Jen.
Hello.
Welcome to the studio.
Thank you for having me.
I'm so happy to have you here. This is a book that I've learned a lot from.
That means so much.
Honestly, it does, because, you know, even when I speak to people as a woman, right, who obviously doesn't have endometriosis, you think of things like, okay, heavy periods, painful periods, may need to lie down, that kind of thing, right?
Yeah.
I think we're just very unaware of it. For you, I know you have endometriosis. When did you realise that something was wrong, that it was more than just heavy, painful periods?
It was when I was 11, and it was with my first period.
Yeah.
And I didn't really know what to expect. Menstrual health education in my school was pretty much non-existent, but my mum had kind of talked me through basics. But I was curled up on the floor screaming. The blood loss was so bad I was passing out. And so, yeah, it was a very, very early realisation that something wasn't what you would expect. And my mum also has an endometriosis diagnosis, so she was able to spot the signs really, really early on. So we went to the doctors at 11, but unfortunately, as is the case with so many of us, we were just told that it's normal. I was unlucky, that, you know, they'll settle down with age. And my mum was even made to feel like she was pushing her own sort of neuroses onto her daughter, which I only found out this year, which I just found enraging. But yeah, for me personally, it was very clear, very, very early on.
So in terms of getting a diagnosis, you were kind of just made to feel, okay, this is just what you've been dealt, right?
Yeah.
When did you get a diagnosis?
It took 22 years.
22 years.
So I was 34 when I received a diagnosis. And I went to the doctor so many times, and so many different doctors, because I'd moved multiple times. So I was in different places. I've been in Wales, in England. Every single time I was just told, it's normal. You're not going to have endometriosis. That's not that common. You're too young. Even if you do have endometriosis, then, you know, you're already on the pill, because they put me on the pill when I was 11. So there's nothing else we can do for you. It was just dismissal after dismissal for 2 decades.
That is a really long time. Let's talk about some of the symptoms of endometriosis. So you said then the heavy bleeding.
Yeah.
So what other things are there?
So endometriosis is a full body condition. It's been found in every single organ of the body and in every single bodily system.
I just want to stop you there. And for people that don't know, how would you describe what endometriosis is?
So endometriosis is where it's a chronic inflammatory condition where cells that are similar to those that you would find in the lining of the womb are found outside of the uterus.
Right.
So it's not the period lining elsewhere, which, you know, has been a bit of a myth and misinformation for a long time. But they are similar to it, and they're found anywhere in the body: eyes, brain, heart, bones, nerves. And so the symptoms are so unique to each person and where they have the disease. But for me personally, they ranged from leg pain, back pain, hip pain, flank pain, so like around my kidneys, chest pain, nausea, fatigue, dizziness, passing out. And they used to be just sort of surrounding my period, but then they eventually turned into every single day as well. So you can have these symptoms at any point.
So this can be a debilitating condition.
Oh yeah. Yeah. I came off the pill when I was in lockdown in 2021. And there was no reason that I came off the pill other than I kind of realised I've never experienced a cycle without being on it. So I thought, well, why not see what's going on? So I came off the pill, and it was like an inflammation nuclear bomb went off inside of my body. And within 3 cycles, I was pretty much bedbound. I had to crawl from the bed to the bathroom at one point because I just could not stand. I was passing out from blood loss and pain. I had to start using mobility aids because my hips would just give way underneath me. It completely changed my life.
That sounds absolutely horrendous.
Yeah.
I know for this book you've spoken to a lot of different people with endometriosis and specialist doctors as well, and you've created this community because you're on social media as Gendometriosis and you do campaign a lot about this. Have you spoken to other people that have had similar symptoms?
Oh yeah, I've spoken to thousands of patients over the last couple of years all around the world. And it's really important to note that if you have endometriosis, it doesn't mean you will end up in the kind of really extreme category. A lot of us are in there, but it's not a life sentence to that. A lot of people can manage their symptoms and they, have milder symptoms. Some people are completely asymptomatic and only find out that they have endometriosis accidentally. So the symptoms really are a spectrum in terms of severity and type, but the experience of endometriosis patients is the same story again and again all around the world.
And there's no cure for this, is there?
No, I wish there was. And unfortunately, the clinical education as it currently stands is not good enough if it exists at all. And so we end up being told that various treatments are a cure when they're not, which ranges from, being devastating if you have hope and then find out that it's wrong, all the way to being told that a hysterectomy is the cure, so you remove your uterus and your fertility to find out then you still have endometriosis. So it's a real sticky point. There is no cure currently for endometriosis. The best we have is expert excision surgery. But even then, that's not a silver bullet.
Do you think that there was a lot of medical gaslighting that went on and still goes on when it comes to endometriosis?
Yes. Yeah. That without a shadow of a doubt. I mean, I've experienced it firsthand. My mum experienced it decades ago. And the younger generation are still experiencing it. I talk to teenagers a lot as well, and they're still experiencing it. So this really has been going on for decades. It's a systemic issue. It's not a case of just a couple of misogynistic doctors. They exist, but by and large, this is a historical systemic issue that's been baked into our medical system, and women have been kind of taught that they have to accept it in order to get access to treatment, which I think is just absolutely infuriating, to be honest. And it ranges as well. You get the kind of death by 1,000 cuts medical gaslighting of, no, that's normal, that's expected, because maybe that's what their clinical training taught them. So they're not trying to be harmful, they're just passing that on. And then it ranges all the way up to the more extreme examples of being told, for example, if you were a horse, you'd have been put down by now. You can't have a hysterectomy for adenomyosis, for example, because no one will want to marry you. And the one before my hysterectomy was that it was a good job that I was infertile, because he had 3 children. So my infertility would balance out the environmental impact of his own.
Someone actually said this to you?
Yeah.
This is insane.
Yeah, a lead of one of our endometriosis centres in the UK said that to me.
That is actually disgraceful. What is it about this that I don't know how to kind of explain the attitudes and stuff. I don't know what it is. I mean, you kind of touched on patriarchal system a little bit, right? So it's that, but I don't know, like, are women's bodies that mysterious that it's just like, okay, this is all in your head? Do you know what I mean?
Yeah, it's a really complicated web of reasons, which is why it's so difficult to unpick. But it comes from the idea that women's bodies are inferior to men's, which goes back millennia. It then comes down to the slightly more modern notion that women's bodies are far more complex because of our hormonal cycle. So we weren't allowed in research until relatively recently. It goes down to the fact of the myth that endometriosis, to be specific about one condition, is a period condition. So therefore it's a women's issue. They need to deal with that. It's not that serious. All women have these periods, so they need to just get on with it. And then, it's this real multi-layered thing. And it's going to take a long time to unpick all of that and try to reverse it. Yeah. But it has to come down to clinical education and, updating doctors on what these conditions actually are.
Because I think a lot of things can be filed under period issues, right? And it's very convenient. It's convenient for, employers, for anybody who isn't a woman themselves, right? Period issues, okay? So
Yeah.
there's a lot that comes under that. And I mean, with our periods, they are quite different anyway, right? So some people bleed very spotting for 3 days, for example. Some people it's super heavy, right? I know people who wear tampons and pads at the same time and they still bleed through.
Yeah.
However, in your experience and with your research and with yourself, when do you think that those warning signs are when people should be like, no, this is more, I need to go to the doctor because it might be endometriosis or
Yeah.
adenomyosis?
So I think that we've got period education a little bit wrong, if I'm honest.
Right.
I think we're focusing so much on what normal looks like. And normal doesn't exist. Like you said, it's so individualized to each person. So instead, I think, like you've just sort of hinted at, that we need to be looking at what are the red flags. What does abnormal look like? When should we be going and seeking help? And there are some red flags for periods and menstruation that, you should kind of start maybe thinking I need some help. So there's things like pain. If your pain is interrupting your daily life, if you're missing school, work, or even social things, if it's not being helped by over-the-counter sort of pain relief, then that's a red flag. In terms of heaviness, it's classed as 80 mils of fluid loss, but none of us are really sitting there with a jug. So again, that's
exactly.
not helpful.
Or you're not bringing out your pads.
No,
you know what
exactly.
I mean? Yeah.
So again, like you said as well, if you're wearing doubled period products, a tampon and a pad, or if you're changing your product, whatever it may be, more than sort of once every hour, 2 hours, if you're flooding through those products, those are all signs that heaviness might be something to look at. Clots as well, it's perfectly normal to pass clots during your period, but if they're regularly more than a 10 pence piece here in the UK, then again, that's something that should be investigated. And then you've got the length of time. So we kind of say a cycle is on average 28 days, but actually between 21 and 35 days is perfectly normal. If it's beyond that or less than that, again, that's one to look at. Or if you're bleeding for more than 7 days, that's something to look at as well.
Right.
But I think the most important comparison is with yourself. So if there are any changes to your normal, that's when you need to kind of think, maybe I need to get some support.
Yeah. Let's talk about flare-ups and when you've had flare-ups and what causes them. What does it feel like, and what are the things like for you? Because obviously, we're talking about your situation here. What are the things that cause a flare-up?
So flare-up triggers are really individualized, and they can be different for every single person, and even different within a person's lifetime. So what used to cause me a flare-up might not cause me a flare-up in a year's time, for example. But for me personally, I do have some very reliable triggers. Alcohol is a big one for me that instantly will cause my symptoms to flare, especially the pain. Caffeine as well, so I tend to try and avoid caffeine. Strenuous exercise, so it's a really hard one because lots of us go to the doctor and we're told do some exercise, that will help you feel better, but actually that triggers my symptoms really badly. And stress, and I hate saying it because it's so, it's that, have you tried being less stressed? Yes, I have, but actually being in this pain actually causes me more stress. But if I can try to avoid stressful situations, that helps as well. But sometimes a flare-up of symptoms is just unavoidable. You can do everything right. You can, live an anti-inflammatory lifestyle. You can avoid stress. You can do all the right things, in inverted commas, and you can still have your symptoms flare. They're just so unpredictable and individual. And it's difficult, but I think as an endometriosis patient, you see so much, especially online, about endo diets or endo exercise programs, and what works for one is fantastic and I'm pleased for them, but it might not work for the next person. And actually it can lead to people thinking, am I doing enough? Am I taking my illness seriously enough? Or am I doing something wrong? Am I causing my illness? And that's not the case at all. It's just finding what works for you.
And you have a flare-up kit as well.
I do. Yeah. That sort of just came out of necessity, and it goes with me everywhere. It's literally in my bag now. But yeah, and again, what I have in that kit is personal to me. So you might not need these things, but I have things like mints for nausea and nausea bands, my pain medication, a TENS machine, which can help with pain, sort of like period sticky pads that you can put on to help with pain. All sorts of things in there. When I was still had my uterus and so I was bleeding, there would always be period products and changes of clothes in there as well. So it's very, very individualised, but it has helped allow me to be more confident in still living my life, knowing that I've got things that I might need. Whereas before I was so panicked and paranoid about it that it kind of was keeping me in the house a bit more because I was just so nervous. But so it's been a big help.
Okay. So in terms of like pain relief, is that basically the only kind of medication, as it were, that would help with endometriosis? And you mentioned the pill as well. Sometimes people find that helpful.
There's a lot of different sort of treatment options, but they are all symptom management.
Right.
So none of them are going to cure endometriosis, slow endometriosis, shrink endometriosis. There isn't anything that can do that. So that's really important to say first. But when it comes to medical options, the one that you will probably be offered first is some kind of hormonal contraceptive pill. The idea being if you control the cycle, you're dampening the symptoms. And it's true, for some it can really, really help and allow them to live their lives. I was on it for 22 years and it kept those symptoms to a point where I could at least cope. You know, I'd still have a horrific week every month, but it meant that I could still cope and I was still managing it. But when I came off the pill, I realised just how much the diseases had actually proliferated underneath that dampening. So it's really important to know that you still need to be monitored and checked. But that can be a really helpful option for a lot of people. For some people, it doesn't do anything at all, so they need to look at other options. Then there's the pain relief, and again, that will depend on your individual pain and how it's affecting you. They normally recommend an anti-inflammatory one because, as we know, it's an inflammatory condition, but lots of us, myself included, can't actually take those. So you end up then into the category of opioids and stronger pain medications on that side. But again, all of these things come with their own side effects as well. So it's that balancing act of trying to manage the symptoms of endometriosis without burdening you with all of these side effects that can be equally problematic. And then there's also on the sort of heavy bleeding side of the equation, things like tranexamic acid that can sort of help reduce bleeding. But again, it doesn't help for everybody. So it's very much a sort of have a chat about the options and see what works for you.
So I just want to talk about surgery because you mentioned that you've had a hysterectomy. That point where you were on the pill and managing to cope, right, and then coming off of it, at what point was the doctor then saying you need to have a hysterectomy, and why?
So the journey between sort of being diagnosed and the hysterectomy was just over a year. And when I was first diagnosed, I ended up going privately because I had an ultrasound on the NHS and they told me there was no endometriosis on the ultrasound, so no further action needed. But it was very, very clear to me and to anybody around me that something was very wrong. So we went privately, had an MRI, and that doctor diagnosed me at that stage. And I had surgery with him, and he told me that I had stage 2 endometriosis and mild adenomyosis. But whilst I was recovering from that surgery, I was in so much pain. Not surgical healing pain, which you would expect, but the same pain that I was in before the surgery. So I spoke to him, and he, despite being the first person to actually believe me and diagnose me, he then dismissed me after the surgery and said that there's no way there's anything else going on. It's probably psychosomatic now. I needed some therapy and to be aggressive with my pain medication. So I was crushed, and it was my husband who said, look, let's get a second opinion. So we did. And at that point, I'd realised the importance of making sure you're seeing somebody who really understands this disease. Didn't quite understand just how complex it was before. And so less than a year after that first surgery, I had a second surgery. And that had multiple surgeons involved because the endometriosis was stage 4. It was all over vital organs. It was choking my ureters, so I was at risk of double kidney failure. And the adenomyosis was at such a advanced stage that the best option for that was a hysterectomy. So that's why I ended up having that,
The difference between endometriosis and adenomyosis, for people that don't know, what is that?
So traditionally, it was thought they were the same condition, just in different locations. So endo was outside uterus, adeno was inside uterus. We now know that they are two completely separate pathologies. So adenomyosis is where glands and stroma, so cells that you might find lining the womb, grow into the muscular wall of the womb.
Right.
And then they grow and enlarge the womb. And you get what's called it's a really horrible word, I apologise, like a boggy uterus.
Right.
A bulky, boggy uterus is normally what they write on medical notes. But it can cause a huge amount of pain, heavy bleeding, and other issues. Basically, your uterus is, well, when mine was taken out, it was about the size of a 5-month pregnancy, even though I've obviously never been pregnant in my life.
Yeah.
And so it was very, very swollen and enlarged.
So were you visibly swollen then?
Yeah. So there's something called endo or adeno belly. And most people who haven't got these conditions kind of think it's like a food baby a little bit, but it's not. It's an extremely painful and extreme swelling.
Right.
And it mimics the look of a pregnancy. Can be that extreme. A bit of a cruel irony for a disease that it affects fertility so much. I literally, before my second surgery, I had such a bad case of it that somebody asked me when I was due, and I was like, oh, that's not fun. But yeah, so it's really, really common as a symptom of either condition. But yeah, it's very painful. It's not a food baby, and it can last for days or normally hours, but it can last for days. So it's not a nice part of living with them.
So how were you after the hysterectomy? How were your symptoms?
So it's a bit of a double-edged one. So in terms of adenomyosis, and I also found out I had fibroids as well during that surgery. So those symptoms are gone, and the relief was instant. I used to describe adenomyosis as feeling like a bowling ball was sat in my pelvis, trying to break the bones from the inside out. And as soon as I woke up from that surgery, I could feel that bowling ball was gone. I don't know how much of that was psychosomatic, but it was genuine. That feeling was gone. So that has been amazing, and not having to worry about periods has been life-changing for me. I didn't quite realise just how much my life revolved around them until I didn't have to deal with them anymore. But for endometriosis, it's not a cure, so I haven't had a pain-free day since the surgery. The endometriosis is back now, and it's on my bowels, my bladder, the vaginal canal, my ovaries, because we retain my ovaries, they're stuck to things. So yeah, it's a bit of a mess in there still, but we're still trying to figure out what the best course of action is. But yeah, thank you for asking.
You're still on that journey then?
Yeah.
Right,
yeah.
okay.
It never ends. And the sad thing now is that when I try and seek support from the medical profession now, it's almost like having to be diagnosed all over again. You either come across doctors and they think, oh, it can't be that because you've had a hysterectomy, so it can't be endometriosis anymore. Or you find ones that know that that's not a cure, but think it's so improbable that it will be back because you've had this hysterectomy. So it's, been a bit of a challenge.
But having a hysterectomy, let's talk about the mental toll of that. When they suggested it to you, I know you felt that there was a bowling ball inside you, but suggesting that and having that means, okay, if you wanted to be a mom, and I don't know if that's something that you wanted, then it's taken away from you biologically having your child.
Yeah.
What impact did that have on you?
So at the time, my husband and I, when we think of fertility, we tend to think of two extremes. We think of the people who know for sure they want a family, they want children, they will do anything to make that happen. Yeah. And then we think of the people who are completely child-free by choice. And we forget that most people are actually somewhere in the middle, that, it's a spectrum and you can slide up and down it day to day. And that's where me and my husband were. We were in the shades of grey in between. Right.
And I think that's quite normal as well.
Yeah.
Like one day, when the time is right, if and when kind of thing, right?
Yeah.
Yeah.
And then the next day it's kind of like, oh, that would be quite, nice and fun to do. So we were very much there. My husband was more on the child-free by choice, and I was still very much kind of, not just yet, but maybe one day. At the point of my hysterectomy, I was in so much pain that I could not even see a life beyond pain anymore. And the thought of even trying to care for a baby was just, it couldn't even sort of permeate into my brain. There was just no chance. And all I could think of was, I want this thing out of me. And so that was where I was before the hysterectomy. After the hysterectomy, that's when the mental side of it really kicked in. And I don't regret the surgery. I would do it again in a heartbeat. But I didn't realise at the time how much I valued the choice to change my mind. And so afterwards, it affected me more than I realised it would, even though I don't regret it. And I think that's really important to note, that it's okay if you have those kind of conflicting thoughts. And at the same time, my sister-in-law, she basically conceived the day I had my hysterectomy, and we're really good friends and we live really close.
Yeah.
So while I was recovering, she was going through her pregnancy. So it was kind of a difficult time, and it was a very stark reminder that that door had closed for me. So it was a lot to process, and I still get moments now where it upsets me, or you think, what if? Or, you know, Father's Day is coming up, and I walk into the supermarket and I see all this Father's Day stuff, and even though my husband was kind of pretty set that he wasn't bothered about being a dad, you know, I still feel guilty for taking his chance to change his mind away as well. And yeah, I don't think, as a, you know, I'm a white woman, I'm educated, I'm very privileged, I assumed I'd always have the choice over that sort of decision. And having that taken away was something that I had never even considered would be something in my sort of future or my life. So it has been a lot, even though I don't regret it for 1 minute. It's strange. It's kind of like that conflicting sort of double-sided coin. And my husband even says, you know, he didn't expect me to react the way I have to it. Not telling me that I shouldn't be reacting that way, of course, but yeah, it wasn't quite expecting that. But it's still something we talk about, even, is it 2 years on now? Yeah, 2 years on, we still kind of talk about it sometimes and work through it. And I think we probably will for the rest of our lives have those moments. But I think what's helped me with the mental health side of it is remembering and recognising that my life, is different, but different doesn't mean worse. It just means different. And remembering what brings me joy and love and fun, and just inviting more of that in. And actually you can still have just a as full and fulfilled life. And it's just different, that's it.
Yeah. Well, thanks for being so honest, because and you were in the book as well, you know. Another thing that I really liked in the book is that you interviewed your husband as well. So I want to talk about relationships and the impact that endometriosis does have on relationships. What would you say are the biggest impacts that it has on relationships?
Every relationship is unique, isn't it? So, but there's just no way that living with a condition like this isn't going to impact your relationship, because it's so all-consuming. There isn't an area of my life that these diagnoses didn't change. So financially, career-wise, friends, socially, just goals and dreams, everything gets put on hold, especially when you're stuck waiting for an appointment for 2 years, and then for surgery for another 2 years. Like that whole period, you're just on hold and paralysed. And that includes your partner. It was really important to me to include his voice in there. And it's not natural to him at all to kind of have these conversations. But whenever we do kind of talk about it, the response and the reaction is always amazing. It's kind of like that. You've enabled us to have these conversations that we didn't know we needed to have. And I think that's really, really important. In terms of how it's changed, it's like we just said, you know, different doesn't always mean worse. But especially during that period where the symptoms were just completely debilitating, Chris became my carer. He completely ran the household. So he did all the cooking, all the cleaning. He would take me to appointments. He would have to do all the basic things like going and doing the food shop. I couldn't do that on my own, so he would have to do that as well. He became the sole financial earner in our household for a couple of years. So and you know, I was the breadwinner before, so that was a huge shift for him as well. And then obviously you go into intimacy and that kind of side of things. A huge symptom of endometriosis or adenomyosis is painful sex. So that changes. And it's been an adjustment for sure for both of us, but it's just doing little things to maintain intimacy, which isn't always about sex, and just making sure they feel comfortable that they also have a voice, and that it's okay if they're frustrated too at the situation. And just, it's so cliche, but communication. just being able to have those conversations makes a huge difference.
Yeah, so important. In terms of the painful sex thing, that's one of the things that I did actually know about endometriosis, that may be one of the symptoms. Is there anything that can actually alleviate that or help that? Because obviously intimacy is a massive part of a relationship, and I know that you said that intimacy is not always about sex, but is there anything that you found has helped with that?
Yeah, definitely. So again, communication and being able to kind of say if something is hurting, switching it up, trying a different position, making use of pillows to kind of tilt pelvises and make sure that things are more comfortable. Lube is going to be your best friend. And there are companies that sort of make products to help with, if deep penetration, for example, is a trigger, which it is often. Then there are products that I think it's called like an O-nut or something, and it looks like a little silicone donut. But yeah, there are ways of trying. But I think the thing to remember is communication, and that, you know, you don't owe anybody sex either. You know, I speak to a lot of people who are worried that their relationship is going to crumble because sex is painful for them, and so they've been putting it off. And I always ask, you know, have you had this conversation with your partner? And they always say no. So they're making this assumption that their partner is not going to want them anymore because of, you know, the painful sex thing. And I'm sure there are some unsupportive partners out there, but generally your partner loves you and doesn't want to cause you pain. So having that open communication and being able to say, can we try something different? That makes a huge difference.
Sure. In terms of people who are considering dating somebody new, I know you have some advice in the book as well. When do you think is the best time to talk about this, that you have endometriosis and it may be an issue?
Yeah. Again, that's going to be so unique to each person. I met Chris when I was 20, just turned 21. So I didn't have to go through that, which is why I talk to other people in the book that have been in those various stages of dating. And the advice that they generally came up with was just do it when you're ready and you're comfortable. And I think that's probably the best advice you can ever give. You're not, you know, you don't owe anybody your medical information. Their curiosity is, you know, up to them, doesn't entitle them to anything. But at the same time, I do think a certain level of openness will help you, because it will allow them to support you. And if they're not supportive of what you're going through, do you really want them in your life anyway? So actually having that conversation quite early can be really helpful. But again, it's so unique to you. If you know that family planning is really important to someone, maybe you do want to have that conversation earlier because it might be an issue further down the line. But again, it's all about communication and just being comfortable in your own self first, and knowing, you know, what you want from a partner, and then seeing if they're ready to kind of come along that journey with you.
How can family and friends best support someone who has endometriosis?
That's a really, really good question. Listen to them is probably the first thing. Don't make assumptions. Don't, you know, decide for them as well. So, you know, you kind of, sometimes you can get to a point where people stop inviting you to things because they just expect you're going to not be able to come. That can be really, really isolating, and for a disease that already feels very, very isolating. So just still invite them, but be flexible with plans. If they need to bail out last minute or leave early, just make sure that, you know, they know you're comfortable with that. Ask them if they need anything, but most importantly, just listen to them. Ask them what they need, because what I need might be different to what the next person needs, and so on. So really listen. Educate yourself as well. When my husband kind of first realised that this was lifelong and that this surgery wasn't going to be a magic fix, he took it upon himself to start learning as much as he could about it. And that just took so much pressure off me to always have to explain myself and justify myself and over explain all the time about why I need certain things. You know, he just knew and understood. So educating yourself, and help advocate for them as well. You know, if they need someone to go with them to a doctor's appointment because they've been gaslit for so long and they just want some support, then offer that support. or just do something nice with them afterwards, something that they enjoy that's not going to obviously trigger any symptoms, but whatever that might be for that person. So there's loads you can do to support someone with chronic illness, but it's going to be different for each person. So my first tip will always be just to ask them what they need.
And what I really liked in this book is that you've actually got a list of things that are nice to say to someone who has endometriosis and things that are not that helpful, which is really important because a lot of people, well, they're scared of saying the wrong thing. And then it's that thing of you always have to be positive, which can turn into toxic positivity, right?
Yes, yeah, quite. I will put a bet on that most people with endometriosis have been told at least it's not cancer, at least it's nothing, deadly, even though in some cases it can be. And it's just that thing of, like you say, they're trying to help, they're trying to be positive, they're trying to uplift you often, but it's actually quite invalidating and dismissive to the person. So yeah, it's important to not make somebody feel awful for trying to help and trying to be uplifted. But it's really important to remember that each case is really, really different. So saying, oh, my auntie's friend had that and she's absolutely fine is not helpful to somebody who's actually completely debilitated by their symptoms. So it's finding that balance.
Yeah. So you have kind of turned your pain into purpose at this point in life, haven't you? Because I know you do a lot of campaigning, a lot of speaking about endometriosis, and then this book. So just tell me about, like, how long did it take you to write this? Because, it's important to say that you're not a medical professional, but you've done a lot of research for this, and this is actually endorsed by medical professionals. So how much time did you put into this?
So it's actually happened really fast. So we signed contracts last August, and it's obviously coming out this June. So it is very, very fast. And I am so grateful to all of the amazing experts around the world who gave up their time in a very borderline offensive timescale to help with the book and to speak to me about their expertise, and all the patients as well, because it was, very, very intense period of gathering all of this information and writing it. But I've been living it for, at this point, 25 years. So it's 25 years in the making, really. And actually, probably even longer because, my mum and people's grandmas have been living this exact same story for generations. So it's been a very long time in the making. But in terms of the writing itself, it happened very, very fast. But I just hope that it help start conversations, not just with patients, but with clinicians, with, allied healthcare professionals as well, just with anybody whose life or career might be touched by endometriosis. I just really hope it starts sort of prompting those conversations.
What do you want people to take away from this book in terms of themes in the book?
Firstly, that it's not just a bad period, that this is a lifelong, systemic, whole body condition, whole life condition, really. And, you're not weak. It's not in your head. This is a very, very real thing. So that would probably be the first one for patients and clinicians, because I think they need to understand as well just how much this disease impacts our life. The second thing is that everybody is unique with their experience of this and how it affects you. I think sometimes we see in the media examples of the most extreme cases, which is really, really important to highlight how bad this disease can be. But it's also sometimes slightly petrifying and overwhelming to someone who's just been diagnosed and maybe is managing their symptoms quite well, and they assume that they're going to end up in that position. And that isn't the case for the vast majority of people. So I think that's really important as well. And also that there are ways to live your life still with this condition. There are ways to access expert care, although it's, accessibility of that is a huge issue. But there are ways to actually live a fulfilling life, even with this disease. It's not kind of like a life sentence. It doesn't mean your life is over. It just might mean that life looks a bit different.
And I think that's so important to give people that hope that you can manage it, and to give people that understanding and people who want to support as well.
Yeah, exactly.
So thank you for writing it, and thank you so much for coming in today.
No, thank you for having me.
I really appreciate it.
Thank you.
Thank you, Jen. Thank you so much for watching, listening. I really hope that this episode has been helpful to you. Please do share it with people that you know and show it some love. Also, make sure that you have liked, subscribed and all of that stuff so that you continue watching The Lifestyle Prescription. Catch you on